Hi, my name is Dr. Ross Hauser. Welcome to Caring Medical Florida in Fort Myers, Florida. One of the scariest effects of cervical instability is how it affects the heart. I've had patients who have made emergency room visits on numerous occasions because they thought they were having a heart attack or a heart arrhythmia and their heart's going boom, 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 boom. It's fluttering, they're getting palpitations, they get sweaty. And so today we want to talk about how cervical instability affects the heart. And one of the more common conditions we see is postural orthostatic tachycardia syndrome. This is just a really good summary of how the vagus nerve and the glossopharyngeal nerve monitor the blood pressure and pulse in the body. For those who have seen me before, know that the vagus nerve and glossopharyngeal nerve are in the carotid sheath, and the carotid sheath is right where you feel the carotid artery pulse, and it runs right in front of the cervical vertebrae here. So if people have cervical instability, then they turn their head to the left, bang, that's going to hit the right vagus nerve, and bang, that's going to hit the left vagus nerve. Or if they have forward head posture, you could see where the carotid sheath could get kinked at C1, at C2. Now, the vagus nerve has some sensors in the aortic arch. So in the aortic arch, the vagus nerve sensors are sensing blood pressure, as are the glossopharyngeal nerve. They're sensing blood pressure in the carotid artery. The carotid artery is the main arterial supply to the brain. It supplies basically 3/4 of the brain in the anterior part. So you could see where it's really important for the glossopharyngeal nerve and vagus nerve to work right, because that's going to tell the brain how blood pressure is doing. And you have to have good blood pressure to have good brain blood flow. Now, the vagus nerve also, what it does is it innervates the SA node and the AV node, and these are the pacemakers of the heart. These are the pacemakers of the heart, and the effects of the vagus nerve are to slow the heart rate down and to slow or lower the blood pressure. So imagine if somebody has cervical instability and it's interrupting the vagus inputs to the heart. What's going to happen if you don't have the vagus nerve slowing the heart rate? The heart rate's going to raise. The heart rate's going to raise. So postural orthostatic tachycardia syndrome is basically somebody's laying down, they're getting out of bed. When they get out of bed, because they don't have good vagal tone, the sympathetic system just goes crazy on the body, and the sympathetic system boom, 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 because the sympathetic nerves cause tachycardia or an increase in the heart rate. If somebody has POTS, meaning they get up, all of a sudden they get very tachycardic, the blood pressure drops, they get lightheaded. The first thing they should think about is, do you have cervical instability or do you have a problem in your neck? Because that's probably what's causing it. So I just wanted to put all the different effects of the heart with vagus nerve stimulation. So in other words, if you have high vagal tone, it's going to decrease the sympathetic nerves effect on the heart. So in other words, even if somebody has good vagal tone and they get excited or they have a stress, like they go from lying to sitting, the heart rate's not going to go up so much because they have good vagal tone. If you don't have the vagus nerve inhibiting the sympathetic nerves, you could get an arrhythmia. You could get atrial fibrillation, you could get atrial tachycardia, paroxysmal atrial tachycardia. You can even get ventricular arrhythmias because if you have unbridled sympathetic input to the heart, there's going to be ectopic pacemakers in the heart, and that's what's going to lead to an arrhythmia. When the vagus nerve is strong, it decreases inflammation in the heart. Contraction of your heart is better. So if you have heart failure, or congestive heart failure, I'm sure you have low vagal tone. There's something interrupting the input of the vagus nerve to the heart. And since the vagus nerve goes from the medulla or the brainstem down to the heart, where does it have to travel by? It has to travel by the cervical vertebrae. And the ganglion, the main ganglion of the vagus nerve, is the nodose ganglion, which sits right in front of C1. Then when your vagus nerve input is high, it's very difficult for you to get an arrhythmia, meaning that also if you take out the vagus nerve, it's so easy to get an arrhythmia. And if you have some kind of heart arrhythmia and your echocardiogram or your ultrasound of the heart has been fine, like there's no structural cause for the arrhythmia, you have to think of you might have a neurologic cause of the arrhythmia. And then I'm going to show you how to monitor yourself at home. And then, you know, the vagus nerve, it increases the pliability of the heart. So basically, the vagus nerve innervates the heart, makes the heart beat kind of slow, relaxed, but it makes it beat it with a really strong contraction, so the ejection fraction is higher, the amount of blood that's pumped out with each beat. So if you're having heart trouble, definitely look into the vagus tone. This is great. So doc, how do I monitor my vagus tone? Well, one way is, do you have a high heart rate or a low heart rate? When you have high vagal tone, in other words, your vagus nerves are really strong. There's one on the right side, one on the left side. Normally in scientific studies, it's the left vagus nerve that dominates in innervating the heart. So in the office here, when we do digital motion x-rays or we do examinations, we often find that people who have heart problems, who have POTS, that the instability is more on the left side than the right side, and the most common place is instability at C1, C2. Or one of the vertebrae, especially C2, is rotated to the left. It's rotated to the left. So if the vagus nerve is right here, like the one on the left side that innervates the heart, and if one of the vertebrae is rotated, right, it's rotated, that could interrupt vagus nerve signals then to the heart. If your resting heart rate, it's normally like 70 and all of a sudden it's 90, you're either under a lot of stress or your vagus nerve input to your heart is starting to go down. And the most common structural reason for it is you have a broken neck structure because of ligament injury in your neck, and the vertebrae are starting to go forward. One of the ways to test your vagal tone is called heart rate variability. What heart rate variability is the beat-to-beat variability of the EKG. You know, when they do an EKG, you know, there's a QRS, 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 so it's the amount of seconds between the two. And the greater your variability, the stronger your vagus nerve is. And you know, that's a general statement. You can monitor your vagal tone at home. So anybody with a heart condition, I would say definitely monitor your vagal tone at home. What you want to look for is your heart rate variability using the elite HRV, is it over 70? Like, that's very good. Is your resting heart rate low? Like my resting heart rate's around 60. When I was doing Ironman, you know, I did 5 Ironmans from 2004 to 2008. My resting heart rate would have been like 56, something like that. I'm not in that kind of shape now, but my resting heart rate is the low 60s. And you know your vagal tone is good when, if you're under stress, like you have a lot of responsibility and your heart rate stays low. So if you've noticed that your heart rate is high, or it just takes a little bit of stress and then your heart rate goes really high, again, that's a sign that you have low vagal tone. And you guys know this, if you look into your mouth and your uvula deviates to one side, or your palate is uneven when you say ah, then you know that's another sign that you're having vagus nerve issues, because the vagus nerve innervates the muscle that elevates the palate. If you've had a heart attack, what determines survival is the heart rate variability. It's one of the major factors. So in other words, the lower your heart rate variability is also correlated with survival. And if you research heart rate variability, and again, we're talking about if you have a good vagal tone, your heart rate variability is very high. If you have low vagal tone, not only can you be prone to having POTS and arrhythmias, but also you increase your risk of illness. It's a really, really good thing to measure at home because it's a good indicator of how healthy you really are. Like, how is your nervous system? Is your nervous system balanced, or it's too far on the sympathetic side? And the sympathetic side, the sympathetic system is the stress system. When your body feels stress, then you want the sympathetic system to be high, but it's only supposed to be high for a very short period of time. Like, say your car breaks down, it's very stressful. In that sense, you just want stress for a very short period of time. Then it's the vagus nerve is supposed to cause your body to relax. If your body can't relax because you have low vagal tone, then of course then you're going to get chronic diseases because your body has no way to calm down, and the sympathetic system causes systemic inflammation, where when the vagal tone is high, the vagus nerve is anti-inflammation, so it causes health and restoration to the body. This is how upper cervical instability causes postural orthostatic tachycardia syndrome. So you stand up and your blood pressure drops, your heart rate increases to raise the blood pressure. The vagus nerve impulses are blocked because you have cervical dysstructure, a broken neck structure, and instability, and then you have uninhibited sympathetic nerves discharging in the neck. So then that can elevate the heart rate, your blood flow to the brain can be impeded, and then you get all the POTS symptoms, which normally is when you stand, you get tachycardic, you get kind of dizzy, you get weak, short of breath, and panic feeling. So the treatment is not going to be medications to lower the heart rate. The treatment's going to be, how can we restore the cervical curve? How can we get stability back in the neck? And the ways we do that in the office is called curve correction, to get your curve good so there's not pressure on the vagus nerve. And then when instability is there, we do Prolotherapy injections, which cause a tightening of the ligaments, especially the capsular ligaments. And the ones we try to hit mainly are in the upper cervical region, C0, C1, C1, C2, C2, C3. What I like to do sometimes is interview some of my old patients or patients that I treated years ago and just, see how they're doing. Linda, now you saw me about 5 years ago, so it was about five years ago. Right. And why don't you just tell us why you ended up coming to Caring Medical and why, and then, you obviously had some horrific symptoms, and then how did you respond to the Prolotherapy?
Yeah, when I first came here, I guess I had had symptoms since 2000, about 5 or 6 years. I had been to multiple doctors all over the United States, including the Mayo Clinic, the Cleveland Clinic. I lived in New York City at the time. I was seeing top doctors there. Eight doctors at one time to try to figure out what was wrong. I'm having a lot of symptoms. I had no prior medical history, except I had a lot of traumatic incidents to my neck with car accidents, and as a nurse, a patient had assaulted me one time. So I was, other than dealing with some neck pain and headaches, that's all of my symptoms. But I started getting all these very strange symptoms, very sporadically, running of the mouth, nausea, diarrhea, feeling weak, like I would faint, tachycardia. I finally had a diagnosis of dysautonomia, and because I was having so many gastrics, and I had to go off work because I worked for a law firm who were very accommodating, but when they can't be sure, I couldn't be sure I was going to be able to go to work that day. One time I remember going and taking a car service into New York City from my house and lying on the floor all day because that's about all I could handle.
This is just for a second, because sometimes it's not maybe illustrated enough or explained enough just how disabling it was. In other words, you had nonstop nausea, right? You had nonstop nausea. Then other times you describe it as real severe weakness, but it's not like a weakness. It's all you can do is lay down. That's how dizzy or lightheaded or I mean, it was horrible. And then you're a mover and shaker kind of a lady.
I was always very active.
I
spent 23 years in the service. I was always active and healthy.
at some point you got diagnosed with POTS or postural
Right.
orthostatic tachycardia syndrome.
Right.
So the question always is can postural orthostatic tachycardia syndrome be treated effectively with prolotherapy?
You know, one of my things at the law firm, I found medical experts. I started searching online to see who would help. And it's funny, I was looking for my mom who had horrible knees, didn't want surgery. And I'm like, oh, there's people that have neck problems like I do. And I started looking around, and then I found you, and I said, hey, he's not far, and I'm going to go see this guy. And I read a lot of your articles and research.
Thank you.
But the main thing, after several treatments, the first treatment, right away, I could breathe out of my left nostril. I could not breathe out of it for years. And I'm like, okay. And the orthostatic hypotension, which was severe, especially here in Florida with the heat, I would get up out of the car on a hot day, get outside with the heat and the hypertension. I would feel like a punch to my gut because I guess the blood system shut down, kind of get lightheaded. But that is totally gone. I mean, no more salt tablets. I don't have to worry about my blood pressure. I can get up out of bed. I mean, that was amazing. And then all the associated tacky stuff from standing up, it's gone. So that's amazing. The nausea got significantly better.
Awesome.
Significantly
Thank you
better.
so much.
Yes. So
what about your energy and just your mental
totally
clarity?
much better.
Okay,
totally
great.
much better. Yeah.
Right.
I mean, I did very well for a while. I had a setback with a breast cancer diagnosis, but other than that, I've been doing pretty well. As I said, I took a fall fairly recently, and
that's why I got to see you now.
Yeah.
Did you? So what would you tell the people who might see this, from around the globe?
Oh, I mean, gosh, it's changed my life. It's something, as someone who had been in the medical profession since the 1970s, I think I read about it once in a medical record. I didn't know much about it, but it's amazing. I tell everybody I know about it because it's really helped me. And I guarantee you, I go to 99 doctors and they would diagnose me with IBS. Which I have had the diagnosis.
Irritable bowel.
Yeah, and I know it's not that because you helped me before so much. So I'm back here and hoping you can tune me up to an even higher level.
Thank you so much. Thank you for sharing your story. Appreciate it.
Yeah. Thank you, Dr. Hauser.
Sure.
I wouldn't know what to do without you.